Thank you very much for joining the Federal Communications Commission Tribal Webinar on the 988 Fee Accountability Report. My name is Bambi Krause, and I'm the Chief of the Office of Native Affairs and Policy in Washington, D.C. So the Federal Communications Commission is an independent federal agency responsible for implementing and enforcing America's communications laws and regulations. Through rulemakings and enforcement activities, we regulate communication service providers. Our work also covers everything from preventing unwanted calls to emergency alerts to ensuring that persons with disabilities have access to communication services and technologies. Today, the Office of Native Affairs and Policy is collaborating with the FCC's Wireline Bureau to offer an informational webinar on the 988 Suicide and Crisis Lifeline and the FCC's role in providing a report to the United States Congress. Death by suicide continues to be a national issue, and suicide rates are the highest among non-Hispanic, American Indian, and Alaska Native communities. In 2020, Congress enacted the National Suicide Hotline Designation Act, designating 988 as the universal telephone number within the United States for the purpose of the National Suicide Prevention and Mental Health Crisis Hotline System. The 988 Suicide and Crisis Lifeline provides 24/7 free and confidential support to individuals in suicidal crisis or emotional distress, and consists of a network of approximately 200 local crisis centers with trained counselors. 988 is an important life-saving resource that will be discussed in today's webinar. With that, I'd like to introduce two presenters from the FCC's Wireline Competition Bureau, Jamie McCoy and Mary Wolf, who are both attorney advisors. They have worked on 988 issues for the Federal Communications Commission and will be giving the presentation on 988 fees and the upcoming 988 fee accountability report. Jamie will lead off today's presentation and question and answer segment. Thank you very much for joining us, and I'm handing it over to Jamie.
Thank you. Hello, everyone, and thank you for joining us today. As Bambi mentioned, my name is Jamie McCoy, and my colleague Mary Wolf and I will be discussing the 988 fee report with you today. A few housekeeping tips before we begin. I will share my screen, and during that time, the chat function will be disabled. And if you have any questions, please email them to the 988 fee report at fcc.gov email. We'll be monitoring those questions throughout the presentations and answer them at the end of the presentation. Your microphones are muted during this time and cameras disabled. The webinar is being recorded and will be available after this session and posted on the events page on the FCC website. Thank you. I will now begin sharing my screen. Sorry, 1 second. First, we'll look at some statistics that highlight the need for better access to mental health crisis services. We'll then move on to the impact on mental health on tribes, the timeline of events that led to implementation of 988, the 988 Suicide and Crisis Lifeline, the impact that 988 has already had, what are 988 fees, current state legislation on 988 fees, the annual 988 fee accountability report, the 988 fee report questionnaire, the 988 fee accountability report results that we reported last year for our first annual report. Then we will discuss some specific sections of the questionnaire and tips for filling it out. At the end, we will go over any questions we received during the presentation. And as I mentioned, please remember to email those questions to 988 fee report at fcc.gov. The need. Suicide is a critical public health issue that impacts individuals, families, and communities. So let's take a closer look at the data and statistics related to suicide as reported by the Centers for Disease Control and Prevention, CDC, and other reputable sources. In 2020, an estimated 3.2 million people planned to commit suicide. 1.2 million attempted suicide. In 2021, an estimated 48,183 people died by suicide, returning to a 2018 peak of 48,344. Suicide continues to significantly impact at-risk communities at higher rates. American Indian and Alaskan Native people are at higher risk of dying by suicide compared with other Americans. In 2021, non-Hispanic American Indian and Alaskan Native people had a suicide rate 99% greater than the general population. LGBTQ youth are more than 4 times as likely to attempt suicide than their peers. For people aged 10 through 14 and 25 through 34 years, suicide is the second leading cause of death. Suicide was the 13th leading cause of death among all veterans, and the second leading cause of death among veterans under the age of 45 in 2020. The impact that suicide has on tribes is even more astonishing. A study found in 2020, death rates among middle-aged Native people due to despair-related causes were twice the rates for white people. A troubling aspect of these numbers is that suicides are occurring at younger ages in non-white communities. Building capacity for tribal suicide prevention through program implementation and evaluation is a cooperative agreement funded by the CDC's National Center for Injury Prevention and Control. Through this cooperative agreement, the Southern Plains Tribal Health Board and Wabanaki Health and Wellness Tribal Organizations are working to increase capacity to adapt, implement, and evaluate suicide prevention programs to reduce suicide-related morbidity and mortality. Let's look at a timeline of the events that led to the 988 fee report. In 2018, the National Suicide Hotline Improvement Act required the FCC to coordinate with the Substance Abuse and Mental Health Services Administration, SAMHSA, and the Department of Veteran Affairs, VA, to complete a feasibility study into designating a 3-digit dialing code for a national suicide prevention and mental health crisis hotline system. In 2020, Congress passed the National Suicide Hotline Designation Act of 2020, requiring the FCC to designate 988 as the universal number for a national suicide prevention and mental health crisis hotline. On July 16, 2020, the FCC adopted rules to establish 988 as the new 3-digit nationwide phone number to connect directly to the 988 Suicide and Crisis Lifeline, and requiring all U.S. telecommunication providers to activate 988 for all subscribers by July 16, 2022. In November of 2021, the FCC adopted additional rules to expand access to this critical service by establishing the ability to also text 988. On July 16, 2020, I'm happy to report the country transitioned to 988, an easy-to-remember 3-digit dialing code. The 988 Suicide and Crisis Lifeline provides 24/7 free and confidential support for individuals in suicidal crisis or emotional distress at any time of day or night. It consists of a national network of more than 200 crisis centers with trained counselors. SAMHSA oversees and partially funds this lifeline. People contacting the 988 Lifeline are not required to provide any personal data to ensure that their privacy is protected. Since the implementation of 988, the impact has been significant. The helpline has provided critical support to individuals in crisis, including those experiencing suicidal ideation, mental health emergencies, or emotional distress. The availability of a dedicated crisis helpline has increased access to mental health services, reduced barriers to care, and saved lives. The positive impact that 988 has had already cannot be overstated. People can reach the Lifeline by dialing the toll-free number 1-800-273-8255 or the easy-to-remember short code 988. Once you dial to be connected to the Veterans Crisis Line, callers just can press 1, or if you're texting, text the short code 838-255. Callers can press 2 to connect with the Spanish subnetwork and remain on the line and be connected to a local crisis center. If, for whatever reason, a local crisis center is unable to answer your call, the caller is routed to a national backup center. So there's no concerns about ever having a call going unanswered. People who text, chat, the Lifeline are currently connected to crisis centers equipped to respond to those texts and chat. And this means that more people are getting connected to care and sooner than ever before. The Native and Strong Lifeline is dedicated to serving American Indian and Alaska Native people. When you call 988 and press 4, you will be connected to the Native and Strong Lifeline. It is operated by volunteers of the American Western Washington, and the calls are answered by Native crisis counselors who are tribal members and descendants closely tied to those communities. Counselors are fully trained in crisis intervention and support, with special emphasis on cultural and traditional practices related to healing. Some other efforts that we've been seeing to support 988 was in 2020, SAMHSA budgeted $282 million to support 988 efforts across the country to increase their staffing and their infrastructure to call centers within the Lifeline network. This included nearly $105 million in federal grants to 54 states and territories in advance of the July 16, 2020 transition to 988. SAMHSA also announced a $35 million federal grant opportunity during fiscal year 2022 to support access to Lifeline services for tribal communities and Alaska Natives. I will now turn it over to my colleague, Mary Wolf.
Thank you, Jamie. We thought that it would be helpful to provide some more detailed information about 988 fees. So just first, what exactly are 988 fees? The National Suicide Hotline Designation Act of 2020 provides that states, political subdivisions, Indian tribes, and villages or regional corporations established under the Alaska Native Claims Settlement Act may impose and collect a fee that is applicable to commercial mobile or IP-enabled voice services in order to help support 988 operations. The 988 fees can be used for costs attributed to ensuring efficient and effective routing of 988 calls to an appropriate crisis center, and for personnel, acute mental health crisis outreach, and stabilization services. States have taken different approaches to collecting 988 fees. Some states have included a fee or a surcharge on a customer's monthly phone bill, while others have collected fees on invoices at the point of sale. Also, although the permissive language used in the Act addresses fees that are applicable to commercial mobile or IP-enabled voice services, some states have also reported collecting 988 fees for wireline services. So we included that information in our first annual report. So we can move on to the next slide. So the Wireline Competition Bureau monitors the current status of the efforts taken by the states, U.S. territories, tribal authorities, and Alaska Native villages or regional corporations regarding 988 fees. As of our last review, 5 states have passed legislation to collect 988 fees, including California, Colorado, Nevada, Virginia, and Washington. 6 states have pending legislation to collect 988 fees. These include Minnesota, New Jersey, Oregon, Rhode Island, Texas, and Vermont. We also note that efforts have been made to pass legislation that will implement 988 systems and support structures that are not related to 988 fees. This type of legislation often concerns appropriations other than 988 fees, such as trust funds, as well as the creation of 988 studies and advisory boards. Currently, 32 states have passed legislation that is not related to 988 fees and that will implement 988 systems and support structures. 18 states and 1 US territory also have pending legislation that will implement 988 systems and support structures. We are currently unaware of any action taken by tribal authorities in Alaska Native villages or regional corporations to collect 988 fees. We do anticipate that support for 988 services through the imposition of 988 fees or charges will increase in the future years. So under the National Suicide Hotline Designation Act of 2020, the FCC must submit an annual report to Congress that details the status of the collection and distribution of 988 fees by the states, the District of Columbia, US territories, and tribal authorities. The report must also include findings on the amount of revenues obligated or expended by reporting entities for any purpose other than to support 988 related services. In order to obtain an accurate and complete information for us to report to Congress, the FCC received authorization from the Office of Management and Budget to solicit information from states, territories, and tribal authorities regarding the collection and use of 988 funding in their jurisdictions. The questionnaire seeks information on each jurisdiction's authority to collect 988 fees, as well as details regarding the amount and use of revenue collected for any authorized 988 fees. The FCC reaches out to governors, tribal leaders, and mental health authorities in each jurisdiction to gather 988 fee information through this questionnaire. For our first annual 988 fee accountability report, the Wireline Competition Bureau obtained contact information for tribal leaders from the Bureau of Indian Affairs. For this year's annual fee report, we partnered with the Office of Native Affairs and Policy to conduct our outreach efforts to tribal leaders. The Wireline Competition Bureau just recently conducted outreach efforts in April for this year's fee report, and we've actually already received several responses. So we wanted to provide a brief overview of the results from our first annual 988 fee report. The first report covered the period of January 1st, 2021 to December 31st, 2021. The FCC submitted our first report to Congress on October 14th, 2022. We received responses regarding the status of 988 fees from all states, major US territories, the District of Columbia, and 6 tribes. 2 states, Washington and Virginia, collected and used 988 fees during the first reporting period. The fees collected and imposed varied by the state. For example, Virginia imposed a 12-cent surcharge on postpaid wireless charges and an 8-cent surcharge on prepaid wireless service, whereas Washington reported imposing and collecting a monthly 24-cent fee for wireline, wireless, VoIP services, as well as a 24-cent fee for each prepaid wireless service. As we discussed earlier, other states have passed legislation regarding 988 fees. However, those states did not collect fees during the 2021 calendar year that was at issue for our first report. We'd like to mention that the underlying data for our first annual report was limited due to the recency of 988 implementation and the limited time period covered by the report. At the time of our first report, 988 had only been active since July 16th, 2022, and the report only covered the period from January 1st, 2021 to December 31st, 2021. Also, as noted earlier and in our 988 fee report for our first annual year, the FCC received responses from 6 tribal entities. So we are hoping to improve responses moving forward and are working closely with the Office of Native Affairs and Policy to help facilitate our outreach efforts. So we thought it would be helpful to walk through a few of the sections from this year's 988 Fee Accountability Report Questionnaire. We will also cover some helpful tips for completing the questionnaire. So this slide shows the first section of the questionnaire. As you can see, question 1 and 2 request very basic identifying information. In order to respond to question 1, you would just need to provide the name of the Indian tribe, village, or regional corporation that is filing the questionnaire. And to respond to question 2, you would need to provide more specific information about the particular individual or organization that is actually filing the report. So for example, last year we received a response from the Choctaw Nation of Oklahoma. The response for question 1 simply listed Choctaw Nation of Oklahoma, and the response to question 2 listed the name of a behavioral health director who was the individual that was actually completing the questionnaire on behalf of the Choctaw Nation of Oklahoma. So this slide shows section B of the questionnaire. Question 1 requests a description of any funding mechanism established by the responding tribe, village, or regional corporation. We would really like to draw your attention to the highlighted portion of this slide. If your reporting entity has not established a funding mechanism for the purpose of 988 support or implementation, then please respond no, and you may end the survey. However, because we really want to make sure that we have complete and accurate information to report to Congress, we ask that you please submit your report and include your response to the first section, section A, that included the identifying information that we just discussed, and to this first question in section B. So moving on to the sections of the questionnaire that are relevant to reporting entities that have established funding mechanisms. This slide shows question 1 from section C of the questionnaire. Section C focuses on general information about the reporting entity's authority to determine how 988 fees are spent. So if there are no entities in your tribe, village, regional corporation that have authority to approve the expenditure of funds collected for 988 purposes, then please respond no here. We can move to the next slide. So this slide shows question 2 from section C of the questionnaire. This section caused a bit of confusion last year, so we are hoping to provide some helpful guidance today. Question 2 requests general information concerning whether your tribe, village, or regional corporation has established a funding mechanism that mandates how collective funds can be used. If your tribe has established a funding mechanism that mandates how 988 fees can be used, you should provide a response to this question, regardless of whether any 988 fees were actually collected or distributed during the annual reporting period. And question 2A here is simply asking that you provide a legal citation to any funding mechanism that mandates how collected funds can be used. If you do not have an established funding mechanism that mandates how collected funds can be used, then we ask that you provide a description of how your tribe, village, regional corporation, or other jurisdictional authority decides how collected 988 fees can be used under question 2B. So section D of the questionnaire requests a detailed description of the uses of 988 fees during the annual reporting period ending December 31st, 2022, regardless of when the 988 fees were actually collected. The focus here is on the uses of the 988 fees rather than the date that the fees were collected. For example, in response to question 1 of section D, the responding entity should provide information for the year ending December 31st, 2022 that identifies all activities, programs, and organizations for whose benefit your tribe or reporting entity has obligated or expended funds that were collected for 988 purposes. You would also need to provide a description of how the particular activities, programs, and organizations support 988 services. Section E of the questionnaire requests a detailed description of 988 fees collected and other sources of 988 funding during the year ending December 31st, 2022, regardless of whether those fees or resources were expended. For example, question 1 here from this section E, request a description of the amount of 988 fees that were imposed during the year ending December 31st, 2022, regardless of whether those fees or resources were expended. So if your tribe or other reporting entity imposed, say, a 30-cent fee on wireless service for the implementation or support of 988, you would provide that information here, regardless of whether those fees or resources were expended. So section E, question 2, requests a detailed description of the total amount of 988 fees collected during the year ending December 31st, 2022. We want to highlight that the focus of this question is the amount of 988 fees collected during the year ending December 31st, 2022. For example, a tribe may have collected $100,000 in 988 fees for wireless service and would provide that information here. As you can see, the question also asks that you report the total amount collected by breaking the information down according to each service type. So wireline, wireless, prepaid, and VoIP. So section F of the questionnaire also asks for detailed descriptions of funds that were collected for 988 purposes that were actually made available or used for 988 purposes during the year ending December 31st, 2022. So I know that we covered a lot of detailed information today, and we want to just provide a review of some basic tips for completing the questionnaire. But before going through those tips, I want to quickly mention that if you have any specific questions about how 988 fees may look for your tribe, regional corporation, or village, please reach out to your tribal organization, mental health administrator, or the legislature in the state or states where your tribe is located. So now I'll just go through some quick tips. This second annual 988 fee report covers the period from January 1st, 2022 to December 31st, 2022. So on the questionnaire, please report information for calendar year 2022 rather than any fiscal year data. If a question asks for a numerical response, such as the amount of a 988 fee that was imposed, please limit your response to a numerical response or a short non-numerical response, such as unknown, none, or not applicable. If your answer to a particular question is no or not applicable, that's completely fine. Please just provide that information on the questionnaire. And as a reminder, if no funding mechanism has been established for collecting or supporting 988's implementation, we ask that you please still complete section A and the first question in section B and submit your questionnaire. So when you're ready to submit your questionnaire, you can go ahead and email that to 988feereport@fcc.gov. And we ask that you not convert the fillable form to a PDF or encrypt your submission. If you have any questions about after the webinar about 988 fees, then please feel free to reach out to us. And at this time, I will turn things over to Jamie.
Hello, I will now cover any questions that we received throughout the presentation. 1 second. First, we received a question asking, can anyone press for the Native and Strong Lifeline? And the answer is no. Unfortunately, at this time, only those in the Washington area or with a Washington area code can reach the Native and Strong Lifeline. Next, we received a question asking, are there grants for tribal entities for 988 services? Yes, there are, and one of my colleagues will put a link to some resources about grants in the chat. All right, well, thank you all for joining today. I encourage you all to continue to submit any questions to the 988 fee report email at 988feereport@fcc.gov. And remember that this webinar has been recorded and will be available on the FCC's event page at the end of this event. And there will be a link for that as well in the chat. Thank you all so much for joining.